You are listening to Cool FM 104.1, and this is a brand new show, Common Ground. That's the name of the show. And our host is Tara Clayton. Also, I'm a co-host with my name's Robert Ishoy. And we have this brand new show. We talked about it, and we are so excited to do this. We are going to continue kind of on the principle of my old show, Issues with Ishoy, of attacking big topics that address everybody. And we're going to focus right here in Cochise County. And the topic we have tonight, I think it's the biggest one.
It's a doozy.
Isn't it?
It is. It is, yeah.
Definitely affects everybody.
Absolutely.
Everybody. And it's health care and health insurance. I mean, I think the system we have in the country today is kind of insane.
Wonky,
Is that
ineffective.
a good way to put it? Yeah. Now, we've done a little research, but we need an expert.
We do.
And I'm going to have you introduce our expert on this topic at this time.
Thank you, sir. So today, our expert is Dennis Walto, and he is the Chief External Affairs Officer for Chiricahua Health. Would you like to say hi? Yeah.
Hey, yeah, great to be here. Thanks.
Fantastic. So we always have somebody on here that's smarter than us, don't we? On
We
the
should.
topic, we should.
We like
on
to.
the topic that we're going to discuss. But I'm going to start off just kind of giving you a little bit of background information on why we think our system that we have in the United States today is absolutely insane. And
Challenging, we'll say.
okay, challenging. I'm going to stick with insane.
Fair enough. Fair enough.
Now, a lot of people always argue the difference between government type healthcare programs and private sector. You know, that's kind of a political battle that people always bring up, you know. But I don't think a lot of people realize how much government is already involved in healthcare.
Right.
So I got some numbers for this, okay? So between Medicare and Medicaid, and I even subtracted the people that are on both.
Right.
Yeah, that's 126 million people, okay? Then we also have the Affordable Care Act. There's about 44 million people on that, okay? And that's government funded. I mean,
Government supported.
government
Yes.
supported, yes. And then we also have the VA, which I'm on, right? There's about 16 million of us, or no, 9 million. 16,
Lots of folks in this area.
lots of folks in this area. By the way, there's 16 more million people that are eligible for VA benefits, but don't get it. I don't know why.
Maybe they don't realize that they qualify. My father was a Cold War era veteran and didn't realize that he qualified until a change a few years ago.
Yeah. So that's probably, you're right, probably the number one reason. And then we got 9 million people on TRICARE, and then we got 2 million on Planned Parenthood. My bottom line is all these programs are either partially or totally funded by the government. In different ways, though. They're all funded different ways. That's 190 million Americans on some kind of government program.
Out of 340
Yes.
million
Yeah.
Americans?
Yeah.
So, yeah. So almost 2/3
Right.
of the population are already on some kind of government medical program. That's either, and they're not all the same. Some
Right.
like, I'm one of the lucky ones. The VA, I basically get everything for free. All my health care is free. Now, Medicaid, pretty much you get everything free too.
Free means at no cost to you.
No cost to you.
Correct.
Doesn't
Yeah.
mean
Correct.
there's no cost.
Yeah, good point, good point. Now, Medicare, of course, people do have a share cost that they pay. So it all varies. But the point being that we're 2/3 already there in some kind of government-funded program, but we have, how many is that? 1, 2, 3, 4, 5, 6 different programs? And all of them have their own administrators. All of them have their own different rules and how you qualify, who doesn't qualify, and who pays and who doesn't pay and how they pay.
There are
And-
companies that only do explanation of benefits for these different insurance plans. That's what my own mom does for a living. She does explanation of benefits. I mean, that's how confusing it is. is that there have to be people who can walk you through what you qualify for and what you don't qualify for under your insurance.
You know, when we talk about health insurance or even the health system in the U.S., we use the analogy of if you were to take the 10 smartest people that in the world, the Steve Jobs, the Bill Gates, the brainiacs that you knew, and you put them all in a room, and you said, I want you to design the most complicated, nonsensical healthcare system you could ever imagine, something that no one could ever figure out, just go crazy. They couldn't come up with the U.S. healthcare system. They couldn't do it. They couldn't do it. It's almost like the Maine farmhouse that started as a cabin that now is a 24 or 2,500 square foot house, and now you've just added on a barn and some more rooms. So it's
Was it the wife of the owner of Remington or something like that had a house in California and just continued to add rooms in this really confusing way? And so it kind of reminds me of that.
Over here, right?
Yeah,
Right.
exactly.
Yeah. Well, now I'm over 65,
Uh-oh.
so I do have Medicare as well as the VA benefits, and I get this look at this. I get this in the mail. It's a book telling me how to use my benefits for Medicare. I mean, that's just one book, and I'm sure this is just what they send me. There's probably a whole library of regulations and rules and all that the people that work there have to know. I mean, it's just kind of crazy.
It's extremely confusing.
Yes.
Extremely confusing.
Let's make some sense out of it, shall we?
Let's do
We're
that.
going to try. We're going to try because, and the cost is so high too. I mean, the cost of insurance. I have, our sponsor, Ruby's Divine Chocolates. Me and my wife own Ruby's Divine Chocolates, and I asked my chocolatier up in the Phoenix area one time, how much do they have to pay for their own health care? Because they've been in business for 30 years. They don't have an employer paying over $2,000 a month is their premium.
Right.
And then they explained to me they still have co-pays
Sure.
and percentages and high deductibles.
Yes.
And I'm like, how in the world can you afford that? Of course, they afford it by passing on that cost to their customers, right?
Right.
Yeah.
So it's all passed on to somebody, but I was shocked that it costs that much money for them just to pay the premium every month, over $2,000 a month.
How wonderful would it be if we could somehow combine these programs and create a collective bargaining agreement with health providers, with pharmaceutical companies, so that we could get better rates and a system that actually makes sense to everyone. I mean, it's so confusing to a layperson, right? It's like whenever you're looking at legal documentation, and yes, a lawyer can understand this, but a layperson cannot understand this information. And so how effective is that? And who is it effective for?
Right.
I think that's my biggest question.
Yeah.
Who does this system benefit? Because it doesn't feel like we are benefited by the current healthcare system, as it were.
And it can get so complicated that people just give up. My wife just told me today she got a bill. I won't say the hospital, but a small minor thing she had done back. And then there was the bill. It was $112, and then what the insurance paid, and then her copay. And then at the end, there was $150 added on, called an adjustment. Well, what was that for? If the bill's $112, why is it $150?
I've always heard to ask for an itemized bill.
Yeah, and she doesn't know. It's like, what's this new charge for? I mean, so she's on the phone calling the insurance and calling the hospital and back and forth, and all three of them on the phone and trying to work this out. And it's a time-consuming and exhausting. And a lot of people just give up and just pay the bill. But,
Absolutely.
Yeah.
Chiricahua serves over 35,000 unique individuals in Cochise County every year. Almost 1 out of every 3 people in Cochise County come to us at some point in the year for primary care. And the commercial insurance portion of that, which is growing, more than 25%, those payments don't come close to covering the actual cost of providing that care. Despite the increase in premiums commercially that we're all paying, when they finally get to the healthcare provider, and this probably goes not just for Chiricahua, but for Benson Hospital or Northern Cochise or Copper Queen, it's not covering the cost of that care.
No.
What's covering the cost of the care are the multitude of government programs that are somehow able to subsidize commercial care. You would think it would be the other way around,
Right, right.
that commercial care would be bearing the brunt and paying most, but it's not the case.
No, and I've learned that from, well, my own daughter. My own daughter who is on dialysis at 20 years old.
Yeah.
And I've seen the bills, and they're outrageous. I mean, you would go broke in a matter of weeks. You would literally lose your home and go broke at the cost that it is. And yet on the bill, because I have private insurance for her, plus she has Medicare and she has Medicaid because she is a disabled adult for the rest of her life. So I could see the bill and how much they charge, and then I see how much the insurance actually paid. And it was a fraction of the bill. So where are they getting the rest of the money? From the government programs.
On a Medicaid, or
Yeah.
other type of disability
Right.
program. Yeah.
And so, but it's so complicated, and you just like look at this and you go, well, first of all, why is the cost so high? And you know what the irony is? I researched the cost of healthcare in the United States. One of the top reasons why our healthcare is so expensive is because of administrative cost because the system's so complex. Mm-hmm. They have to have high administrative costs to handle all this.
Well, one of the key positions, I think, at Chiricahua is a position of a navigator. And it's a relatively recent innovation that we need people who can just be working with our patients or would-be patients to walk them through the system. What's your income level? Where do you live? What are you eligible for? What else might you be eligible for? What will you need to pay? So we have people who are able to work one-on-one, English and Spanish, and make sure that someone is aware of what they're entitled to and also what their program might cover. So that's a critical part now of healthcare delivery, is people with that information sharing it with patients.
Yeah. And then a billing department. I can't even imagine people that work in a billing department.
Well, this is, go back to that room with Bill Gates and Ruth Bader Ginsburg, right? And now throw in some billing codes. Add some codes and make sure that there's A's, B's, and C's for every number.
Yeah.
For those codes. And then that the codes are going to change. And you're going to add some new ones and subtract.
So kind of sounds like, okay, first of all, we have this complex system with multiple government programs, plus the private sector, plus still 26 million Americans that don't have any insurance from what I looked up. So you have everything across the board. Our health costs are the highest in the world. I've researched that. Almost double what most of the European countries. Their cost per capita, per person, our cost is almost double. For example, I think 23 results. Ours was over 13,000 per person per year, where France, Canada, Sweden, all these other countries that have great health care are just a little over 7,000. Almost double.
I'm going to veer just briefly off topic for a couple of seconds, because whenever I lived in Ohio, I grew up there, and whenever I lived there, our dental insurance under Medicaid for Ohio Medicaid, they paid $5,000 per child for braces as preventative coverage, because they found that whenever they applied preventative maintenance to people's teeth, then they had lower costs in the long run, right? Because we'll say it's, I think, an average of around $500 to do a surgical extraction on one tooth. And what we have 32 including or not including wisdom teeth. Anybody remember? Okay, not including. Okay. So, I mean,
36
that's
if you're really smart.
So that's a lot of money compared to the $5,000 that you can pay for preventative maintenance, which helps you maintain your teeth, keep them cleaner, because they're straighter and easier to brush and floss. So, I wonder how much more money we are costing ourselves as a nation in areas where we're not employing preventative maintenance strategies in healthcare.
Right.
And those numbers are out there, and I think that, it may be an adage, prevention, ounce of prevention, pound of cure, but we don't seem to really take in that fact, because the investment in prevention, it's what is keeping people out of the hospital, right? It's keeping them healthier, and in a population health sense, which is one of the foundational aspects of federally qualified health centers like Chiricahua, it is all about population health as well as patient health. If you treat the community will be healthier and will not cost you as much money in the long run. But if you don't have insurance, for example, and you skip those initial steps of prevention
Yes.
and only come in when a disease has manifested, you're going to cost the system more. And that's proven.
And it can even cost a life.
It can.
'Cause
Absolutely.
people-
Yeah,
I know right here, and I won't mention any names, but I know right here in Sierra Vista of a young man that was a mechanic in his 20s, and it was dental. He had a terrible infection on his tooth. Didn't have the insurance, kept putting it off, but he literally died
They died,
from
yeah,
the from the infection from the dental.
There are stories, kids, the same thing. They just don't have that insurance. Their tooth gets infected, right? They have something in there, and then suddenly it progresses to where
Yeah.
they die. They
And
pass away.
and literally cost you your life in your 20s. I mean, what a sad story. All because he didn't have the money to pay for the dental care. You know?
So the Affordable Care Act, venturing that way, was really put in place to expand that insurance pool, to make sure that that population that weren't living below the poverty line, but that weren't quite making enough money to enjoy commercial insurance, that they somehow had access to, not completely free, but subsidized, tax credit subsidized health insurance. And it's Medicaid. When we talk about Medicaid, Medicaid is health insurance. It's administered by Banner, by Arizona
Right.
Complete Health. These are health insurance companies. They are payers. So even though they're contracted by the government, it's a commercial entity providing health insurance.
Right.
Right.
Medicaid is health insurance, full stop.
Yep. Yep. And it seems to me from the system that we have, we got the winners, we got the losers, and then we got the people in between. And a lot of people, I think, have in their mind that, well, all the people that are benefiting from this are the poor unemployed. Well, yes, to a point. If you are very low income, you can get the benefits. But the people that are really suffering, what I've seen, are the people kind of in the middle. The people that are actually working, they have a job, but their employer doesn't offer one of these plans that, like big companies have.
Right, the working poor.
Yeah,
right?
the working poor.
And the way that I refer to that is like too rich to be poor and too poor to be rich. We're somewhere in the middle where we're falling through the cracks. And I've experienced being on subsidized health care. I've experienced being without health insurance. And I've also had to pay privately. So I've kind of, other than, maybe Medicare or TRICARE, I've kind of run the gamut in terms of what offerings there are. And it's very challenging, very challenging. And, to your point with your daughter, thank goodness you're able to help her with private health insurance to supplement, because, what would that look like had she not, did she not have you? Yeah. How challenging would that be for her? And there's this movie, I think it's called Two Hearts or Purple Heart or something like that, and this woman has diabetes, and she gets married to a soldier because he has insurance that he can help her with because she can't afford her insulin. And so, how many people are finding themselves in situations like that?
And I think it's been framed incorrectly as Republican versus Democrat or left versus right. Governor Brewer was the executive who expanded Medicaid in Arizona and allowed for that middle group that you refer to have the ability to buy into coverage, to buy into health insurance. For 100% to 138% of the federal poverty guidelines, that's the expanded Medicaid pool. Those are the working class that couldn't afford insurance. I think 38 or 139 to 150%, were able to then buy marketplace insurance up to 200%. So you've got this other cohort as well with tax subsidies that allowed them to have insurance that, again, in the end, saved money
Yeah.
because they did preventative care.
And the other crazy part is, since everything's based on your income, and for example, even my daughter, being on Medicaid, has to have a certain income level. Because she does work. I mean, she has a job, she works. If she goes above that, she could lose her benefits, right? So
Right.
I can imagine working people. I got a job. Let's say I'm a single woman. I got a job. I got 2 kids.
You're telling my story right now.
Am I? Okay.
You are. Yeah. The first 10 years of my adult life. I was working full time. I had 2 young, small children. I was a single mother, and things were very challenging. And I found myself kind of in that position where, for 10 years, I worked full time, and sometimes I would have to pull back just a touch because they would tell me that I qualified for, $26 in food stamps or something, in SNAP benefits or something like that. It's very, very challenging to find yourself in that catch-22 where if you make too much, you're just really out of luck.
Yeah.
And if you don't make enough, then goodness, you can't even pay your rent and your utilities. So what are you supposed to do? And I always drove a used vehicle that I purchased outright. So I didn't have exorbitant expenses.
So the irony is you don't want to make more money. It's like, I even looked it up because I'm going to retire soon and I'll lose the insurance. I don't need it because but my wife, okay, what is she going to have? Mm-hmm. She's not a veteran. She doesn't have the VA benefit. So I looked up the Affordable Care Act, and I thought, if I just have to report my Social Security, you might be able to qualify for this big discount, right? And then I thought, but if we did that, if you ever went and got a part-time job, you could lose that.
There's a threshold. Right,
yeah, so you're like, okay, I'm not going to lose $2,000 a month in benefits if I'm going to just make $1,000 a month more. That doesn't make any sense.
Right.
So it's a system almost keeps people down, is my point. Is that don't make more money, because if you make more money, you're going to lose your benefits. So
you have to make a big jump all at once to be able to afford to be making more money.
Right. So it's like the system's almost set up to just keep them in their place, and if you try to get out of that, it could cost you more money than you're going to gain.
Well, use the example of a progressive income tax, right? A system could be in place that would require more of people who make more and less of people who make less, and find that balance. We don't seem to have that balance right now.
Yes, we don't. And we have all these, common sense to me was just get rid of all these different government programs and have one for everybody. I mean, it just seems like it would eliminate all this complexity.
Did I just hear Bernie Sanders and
Confusion.
Medicare for all? Is that
I
what I just heard?
Well, the first, now how you do
Sounds
it.
a little socialist, Robert.
No, I'm not. No, and believe me, I'm not. But when I look at something like insurance and healthcare, I think of more of community than I do private sector. I just, why is it all for profit in the first place? And even your insurance companies, Blue Cross Blue Shield is actually a nonprofit organization. They were one of the first, started in 1929. I think I looked it up. When they started, they're nonprofit. And then you have other insurance companies that are for profit.
Right.
You have hospitals that are for profit. You have hospitals that are non-profit. I mean, it's just everything's across the board. Japan, by the way, passed a law that all hospitals have to be non-profit in Japan, and they all have to be run by doctors.
Ooh.
Yeah.
That's fantastic.
They have to be run by doctors, not by some kind of administrator. Isn't that interesting?
I don't know if doctors are trained in administration.
Well,
I mean,
yeah.
we happen to have a very good CEO, right, at Chiricahua. He's a pediatrician. He's running a $70 million a year organization. Well, they don't teach you that in med school. So I don't know. There's some level of administration is still
right.
necessary.
At the same time,
Yeah.
and I'll counter that with my own experience working for a behavioral health organization here locally, and it is for profit, and their administrators, their board, from what I understand, they're not medically qualified. And so what then we run into is these are folks who don't understand the boundaries and limitations that they were putting on myself as a behavioral health provider, as a paraprofessional. And so I'm living within this system, working within this system, and I could see how unjust the system was. It was extremely frustrating because they don't understand the nuance of billing and, client quotas and, meeting our financial quota for this for-profit entity. It was extremely frustrating and felt very limiting.
Well, I would argue at the same time, Blue Cross Blue Shield would tell you there's no mission without margin. There has to be, you can't continually lose money because you'll go out of business. As a not-for-profit, you go out of business. Right. Unless you're meeting that. I mean, any profit that comes into Chiricahua gets rolled right back into the field, right? We don't have shareholders who then we are able to reward.
Yeah.
But, I mean, we have to operate in the black, or else 1 out of every 3 people here in Cochise County wouldn't have any place to go for healthcare.
Right.
For those of you who might just be tuning in, this is Cool FM 104.1, and this is the show called Common Ground. Our host is Tara Clayton, and I'm a co-host, Robert Ishoy. And our guest, I'm going to let Tara tell you who our guest is. We are discussing medical insurance and the high cost of the medical across the board in our country. Our guest is Tara?
Yes, and our guest is Dennis Walto, who is the Chief External Affairs Officer for Chiricahua Health.
Great to be here.
So if you just tuned in and heard this crazy conversation going on,
we're glad that you're here and that you're tuned in.
Yeah, but we are. I think we're all pretty much of the mindset that the system that we have today doesn't really make sense. It's complex. It's multiple complexities. I'll put it that way. You have multiple government programs. Almost 2/3 of the population are on some kind of government-funded program in healthcare. Then we got the private sector. We got nonprofits. We got profits. We got insurance companies. That are all it's very complex, and it doesn't seem to be working out very well because the United States has the highest cost per person in the world by far, almost double other countries that are highly developed like Sweden, Canada, France. And our healthcare actually is lower in quality, what I've researched, because of the complexity of the system.
Well, and two, let's address the elephant in the room, okay? There are a lot of people who live in border communities or, counties adjacent to border counties who go across the border for medical care. If our health system is so great, why are people going out of the country to seek medical care of any kind?
Yep, you're absolutely right. I work on post. I've had guys on post tell me that they'll go across the border to get dental or health care.
So amidst this complexity, and we all acknowledge that we have an incredibly complex system, it seems as though the last couple of efforts on simplification haven't really simplified. They've made it more complicated.
Good point.
And, HR 1 is one of those examples. Very few of the reforms that have been proposed, I'll say, and approved, right, in HR 1 have taken effect. But it won't simplify the system. When you ask people who are on Medicaid, for example, or tell them now they have to re-enroll every 6 months as opposed to every year, that adds a level of complexity, not just for the patient, but for the administrator.
Right.
What verification are you going to use? You file taxes once a year. So what's the 6-month criteria?
Yeah.
Did anything change? Are you making more money or less money? And none of this, of course, was detailed out in the bill. The bill, even though it was 875 pages, didn't quite say how CMS, the Center for Medicaid and Medicare Services, are going to administrate this. But now, beginning in 2027, which gives us 14 months, but in 2027, we're going to have to figure out what that 6-month criteria, what data is going to be used to either say, yeah, you're still eligible, or no, you've fallen off eligibility.
So we keep putting Band-Aids on our medical
Well,
system. Get it, Band-Aids?
Yeah.
We could, and it doesn't really solve anything.
No.
Sometimes it makes it worse.
It seems as though some of the new requirements, work requirements, are going to take, and you mentioned it a couple of minutes ago, right? The administrative costs. The administrative costs are going to go up, not down. If we have to verify work requirements, we have to
Yes.
verify eligibility every 6 months. If there needs to be a reexamination of that marketplace system and reduce the amount of time people can apply, that's going to complicate administration, not simplify.
Wow. Yeah. Now, you've been mentioning the Chiricahua Community Health Center quite a bit.
Centers.
There's one here in Sierra Vista.
We have a whole primary care campus.
Okay.
Here, right.
So we have one here. Now you do pay. It's not free.
It
But
depends.
But if you're low income, they help you. Am I right?
It is, we will see Chiricahua's mission is to see anyone regardless of their ability to pay. When you come in the first time, if you're a new patient, we will have somebody work with you and see what you're eligible for. And if you make too much money for Medicaid or expanded Medicaid, we actually have navigators that will help you look for insurance. That will not prevent you from being seen.
Wow. Okay. Fantastic.
So we have a sliding scale, and as I mentioned earlier, about 25% now of our patient base is commercially insured.
Okay. So you not only give them the care they need, you actually help advise them on how they can get covered.
Eligibility, yeah.
Eligibility.
If they're eligible.
Wow.
Yeah.
And that's right here in Cochise County. They're in Douglas. They're in Sierra Vista. They're multiple
Let's start
locations.
south. We'll go Douglas, Bisbee, Sierra Vista, Benson, and we have a new clinic in Wilcox.
Okay.
Our original clinic is in Elfrida.
Okay.
So we cover every inch, every 6,200 square miles of Cochise County.
And that's why you're here. So for our audience, if you're out there and you're like, okay, I'm in one of those categories, I'm struggling, I don't have good coverage for health care, I can't afford it myself, you got someplace to go.
And we have a phone number you can call, 520-364-1429, 520-364-1429. Bilingual operators available to talk to you, and if you don't have insurance, they will refer you to one of our own navigators who will help you walk through the system.
Okay. And if you're anywhere up in the Tucson area, just to let you know, there is a clinic in Tucson. I'm going to see if I pronounce it right. The Shubitz Family Clinic. It's run by the University of Arizona's Medical Center. They actually have a lot of the students that volunteer under the oversight of actual doctors,
Sure.
the students. But
That's fantastic.
yeah,
Yeah.
and it's free.
And we have a partner,
It's free.
El Rio Health Centers, based
Okay.
out of Tucson, is a federally qualified health center that serves the greater Tucson area as well.
Now, the big one I read about is up in Phoenix, called the Mission of Mercy. This organization, unfortunately, nothing in Tucson, nothing down here, but there's about a half a dozen locations. It was started by a lady, I don't know, just a very strong, faithful lady in spiritual matters, and it's absolutely free for people that don't have insurance. If you have insurance, they'll turn you away because they're like, okay,
That isn't the client base they're
Right.
serving, right?
But if you don't have insurance, you can walk in the door and get health care, and it's free.
What a blessing for people who are struggling to secure insurance,
We need one of those down here, I think.
We have Health for All. We have, Chiricahua's vision, right? That's what we live by, Health for
Yeah.
All. You can come see us, and regardless of ability to pay, we will take care of you.
And I agree with you. You said earlier, nothing's free, all health care. And me personally, I'm covered by the VA. They pay everything. And then I've got my wife on private insurance, but when I retire, that's going to go away. What are we going to do?
You'd be surprised, though, Robert, that people will come in and be against government health care, but the VA is okay.
Yeah, right. I know. I work with a lot of them, and it's like
And you don't want to correct. We're not in the business to correct people.
Yeah.
You smile and nod.
Yeah, yeah. And I've worked with veterans that have that attitude. I'm like, dude, you served 20, 30 years in the Army. You had free health care. Now you're a veteran, VA, free health care. That's all government paid, by the way.
Right.
Yeah.
Well, and I think that, people, I can't speak for myself, but in conversing with other people about that topic, veterans feel that they truly earned those benefits, right?
And they have right?
And I absolutely would
Yeah.
never disagree with that. At the same time, I worked full time. So I qualified for Medicaid while working full time with 2 children. So I think I earned that Medicaid because I was still paying taxes too.
Yeah.
You earned access to health care.
Yeah.
No matter what we want to call
Right,
it, access to care is an essential right.
Right.
I believe so
And
too.
that's
I
how I
believe that
look at
healthcare
it.
is a human right.
That's how I look at it. I go, okay, great that I'm covered, but I also want my wife covered, and I also want my 20-year-old daughter to have the medical care she needs, or it's life. If she doesn't, she dies.
And
It's
frankly-
that simple.
And frankly,
So-
my neighbor, if I'm out in the community and I see someone who's having an asthma attack and they don't have an inhaler, I mean, what do we do?
Yeah.
Are you just going to not care because that person couldn't afford to pay?
Well, this whole this concept of population health, that you're only as healthy as the community that you're living in. If someone has tuberculosis, God forbid, highly infectious,
Yeah.
right? We want that person to be treated. It's easily treated, regimen for treatment. Then you're cured. You're no longer exposing people
Right.
in
Good
your
point.
community.
Good point. Yeah.
So that's where the preventative element really comes into play.
Yeah. Yep. And the cost goes down. So I would rather pay money myself than have the free health care that I have if my wife and daughter are going to also have health care at a much better reasonable cost. I mean, that's how I look at it, personally, is why would I want my daughter to have, oh, by the way, also another statistic, another crazy one. The number one cause of bankruptcy
In
in the
America is
country,
healthcare.
healthcare.
Yeah,
Cost of
Medical
healthcare.
debt.
medical debt.
Yeah, isn't that crazy? Number one reason for bankruptcy in our country.
Right.
So bottom line, the programs that we have don't make sense. Me personally, I would think the smartest thing to do was first go to all these other countries and see how they're doing it. Canada, Switzerland, Japan. What programs are you running? How does it work? What doesn't work? What's working really well? And really get smart about it, and then come back and look at our system and say, do we really need multiple government systems, all with their own admins? Maybe we should look at just one system for everybody, maybe. And what that system is, I'm not saying, it might be the state-run programs. It might be, I personally would rather have it state-run than federal, but that's me. I'm kind of a states' rights guy.
I hear that, but then I have concerns about, states that don't have as much income and then states that have far more income. So what about a state that is really struggling to be able to cover their own costs and finds benefit, the people of that state find benefit from other states that have a surplus of funds being able to help them out. So
Good
then
point.
what happens? Do those states then just struggle?
Yeah.
With the federalized system that we have, interestingly, states like Kentucky, which have some of the highest rates, I don't know if in your research, Robert,
I didn't
this
read
was-
that.
some of the highest rates of Medicaid populations are actually feeding the system at a much reduced level than, a wealthier state that, still has a large number that might be on Medicaid, but they're putting more into the system. So there isn't really an equity there. There isn't a parity. So we do need to find a system that seeks to, be able to support itself in a way that results in a healthier population.
Yeah. Maybe the idea of things being run at the state level, but maybe financed.
Well, an expanded Medicaid tried to do that, right,
Yeah.
in the Affordable Care Act. It was up to the states to buy in to it, and the federal government made it very attractive, paid 90% of those expansion costs. That's pretty attractive.
Yeah.
So that's why Governor Brewer did it when she did it.
So it's funny because most people that are against the concept of any kind of government or universal health care or something like that, I don't think they realize that we're
pretty close to it now.
we're 2/3 there already.
Yeah, yeah.
And then-
Truly,
and
yeah.
but you
And
have
Medicare is 100%,
Yeah.
right? It's,
Right.
Even though that too is semi-privatized because you have commercial insurers in the Advantage program and some of the other add-ons to Medicare. They provide additional coverage, additional services for additional cost.
yeah.
So everybody kind of has their hand in there somewhere.
And I don't, what other options would there be? I mean, if you're one of those people that thinks we could go all the way back 120 years to where everything was just privatized, you just went to the doctor down the street.
So Chiricahua's health for all, this would be a health for none? Or
Yeah.
Health for some?
Yeah, I don't think we can ever go back to that where,
I don't think so.
The
We're not
doctor
going to put
come-
that genie in the bottle.
Yeah. So but the system we have today just is mind-boggling, and it's costing us all a lot of money one way or the other.
I do want to emphasize, though, that for listeners, and I know I've said it a couple times, you do have help to navigate. We can help you if you think you might qualify, or if you recently lost status or enrollment, or your jobs have changed. You can call us, and we can try to work with you to see, what you are eligible for, what you're not, and what your options are.
Oh,
It's
big
really
call.
important.
Do you do dental?
Yes,
Oh, wow.
yes.
So wow, okay.
We
Man.
do dental.
Okay.
Dental is, again, one of those 10 people that we put in a room at the beginning of the show. They couldn't have come out with the dental program that we have. It's incredibly complicated because adults, even on Medicaid, I think they're not eligible for non-urgent care.
That's correct.
Non-urgent care, so you can't just get a checkup.
I'll speak for myself whenever I say that after moving to Arizona, with the differences between Ohio Medicaid and Arizona Medicaid, I didn't receive a cleaning for
No.
years under Medicaid.
Yeah.
But yet, if you had a tooth that was, you had to have extracted, yes,
Yes,
you can do that, but not preventative.
right.
So
It's nonsensical.
Yeah. Well, the dental, personally, I'm very concerned about because I'm old, and my teeth are literally falling. I have a front tooth that's loose now, and
don't wave it at the camera.
yeah, I'm not, But again, when I retire, I lose my coverage.
Right.
Yeah,
Right.
I won't have that benefit anymore, and I'm like, okay, how am I going to pay for dental?
So you're taking care of everything right now, right?
Well, I'm trying to, but just trying to get appointments. Oh my God.
I think Medicare does cleanings, right? Don't they? I think my mom. In
I'm the
her
wrong
80s,
person to look at.
Absolutely.
She gets her cleanings once a year.
When I retire, I may be coming to you for help on the dental issue. Hey, how can I get this? But yeah, it's a big concern, and you get old, and you're like, okay, let's be honest. As old people, I'll say it first. We're the ones that need the most care.
Sure.
We get old. You need more dental care. You need more medical care.
Well, let's keep it that way, though. Let's keep it to where younger people have access to preventative care,
Right.
are getting and encouraged to have yearly checkups. Even the insurance companies now are incentivizing quality measures. So for you, Tara, right, getting your breast cancer screening every year
Yes.
is a quality measure.
Yes.
And we will be incentivized if we can demonstrate a certain percentage of our population has gotten that screening.
Right.
Because they know that it's that ounce of prevention, pound of cure.
And that makes total sense, and it's better quality of life.
Yeah,
You're
right,
not,
for everyone.
you're not
Right.
suffering, with
Right.
some kind of illness. You want a high quality of life. So I think we're all pretty much in agreement that we need to
That we
make a
want healthcare.
change. We need a
Definitely.
change, and I'm personally kind of leaning towards the idea of some kind of universal health care. Again, probably a lot smarter people than me to do all the research and figure out. Like I said, why not find out from all these other countries what's working and what's not working?
Well, and like I said, who is benefiting from the current system? Because as complicated as it is, it doesn't seem that it's necessarily anyone here at this table.
Right.
No, I
I
know.
mean, because all of us need to, and I'll go back to the
Yeah.
no mission without margin. Even the nonprofits like Chiricahua, who are operating countywide, right, we're the 7th largest employer in Cochise County. 7th largest
Wow.
employer. We inject $1.3 million every 2 weeks into the economy just through payroll,
Wow. Okay.
right? And
Yeah.
even as an organization that is a nonprofit running very close to that margin, we have to make sure that we're billing at a rate that compensates for, those staff and those services.
And I want my doctors and my dentists and my nurses to be qualified, and
Qualified
I want
and
them
happy
I
and
want them paid well.
incentivized,
I
yes.
do. I want them paid well.
They do too.
So definitely, and they deserve it because I mean, just the schooling alone is. I mean,
And we're in Cochise County. We all have our eyes open. It's very difficult to attract medical professionals here.
Yes.
There's a federal stipulation called a health professional shortage area, HPSA. We are a health professional shortage area for medical, dental, and behavioral health providers. We don't have the ratio you need for a healthy population.
Well, and we did mention that Chiricahua provides dental care, but I don't want to be remiss and forget that you also provide behavioral health care as well.
Very
oh
correct?
wow,
Yes.
okay,
Yes.
man, you're just
It's the full suite of
Wow.
primary care.
and that's important. I'm glad you brought that up.
It's
Yeah.
a fantastic resource.
Yeah, the mental health is a big issue all on its own.
It is.
I mean, just think about the news in the last week. I mean,
Yeah.
that's all you got to think about. We need to make sure people are getting the care they need.
So
But-
that, when we look at a 35,000 person patient base, right, many of those are duplicate service users. They're coming in for medical care. They realize, oh, you have dental, I want to go here. And here in Sierra Vista, they can go to the same Calle Portal address and find adult medical, child pediatric medical, behavioral health, mental health providers, and dental, all on the same campus with a pharmacy to fill your prescriptions, all in one primary care campus.
Do you guys, does your organization get donations from like,
Yes. in fact.
okay, okay.
And there's
Thank
also
you.
a nutrition provider as well, correct?
We do. We have, yes, nutritionists on staff. We try to couple and really coordinate those visits. There's a little issue going on now where some providers won't pay for the dietitian to come in if they've already had a medical exam the same day. They want them to come back the next day, which doesn't make sense, but we're fighting it. It's a court case.
It's such an inconvenience because a lot of times
Look where
people have
people
to
live.
and you have to take time off of work to go to the doctor oftentimes, and so now I have to take 2 days off in a row if I want to
Right.
see a nutritionist.
Yeah.
And how is that preventing people or dissuading people from seeking those extra services
Right.
that can really make
Yeah.
a big difference in prevention?
And I think that analogy is the right one, that you might live in Whetstone, you might live in
Yes.
Huachuca, and you want to either go to Sierra Vista or Benson for an appointment. You've got to take the time off. You have to have a car, because there's no
Yes.
buses.
Right.
You're going to have to, make that effort, and why not couple those services all in the same day? And so the Sierra Vista Primary Care Campus, one of the reasons that we've co-located all those services with the pharmacy is that reason.
Yeah. Oh,
That's
pharmacy.
wonderful.
Pharmacy, critical.
That's another whole topic too.
It is. It
I-
is.
It does. Oh, I found out about the pharmacy benefit managers.
Yes.
In between, we won't go into it.
No.
It's another whole show, I think. But another one of the top reasons why our health care is so high in this country, from everything I researched, is the pharmacy issues.
Well, the
That-
cost of medications
Yes.
are very high. In the last administration, there was an effort to have negotiated rates, especially for Medicare drugs. Some of those, my understanding, have been removed or taken off the list, but it's.
But
a
how they
huge cost.
operate, it sounds a little shady to me, honestly.
Oh,
I
the,
mean, the pharmacy companies keeping the lower, what do you call them? The off brands. What do you call them?
Generic.
The
Generic,
generic.
yeah.
Thank you. The generic. They keep them down and try to not allow those to be used so they can keep the high cost.
We could have, I'd be
Yeah.
happy to have our pharmacy director, David Merrill, on the show. He's incredibly bright. He started the Chiricahua pharmacies about 6 years ago Last year, we did 280,000 scripts,
Wow.
Oh,
and it's only 5 years old.
because
That's amazing.
Yeah.
He's an incredible resource.
And what we could do, and I was looking it up, and just kind of makes you feel a little funny. We're like, I'll mention the names. I'll go ahead. Aetna, which is an insurance company, is owned by the same company that CVS Pharmacy is owned by, which they also have a pharmacy benefit management company called Caremark. So you have one company that owns the insurance company that you have. They also own the pharmacy that you're going to go to, and they also own the middleman that deals with the pharmacy and the insurance company, all one company.
That doesn't sound like a monopoly, does it?
No, a little
One-stop
bit.
shop,
Yeah, one stop.
Yeah, we would criticize it if it were the government.
And you think, okay, if you don't know that, and you're like, okay, you're calling your insurance company, and you're like, well, yeah, you don't know that they're all actually the same company that you're
Right.
dealing with, and you're going to pay what they tell you to pay.
Right.
You know, it's like, yeah, this crazy stuff. The more you research this stuff, the more mind-boggling it gets.
And you go back to that room and you say to those, could you have designed this system?
Right.
Could you have come up with a complicated, you haven't even gotten into the codes, even the pharmacy codes and what's on and off of a prescription list. Oh, we can, that is covered. Oh, that one's not covered.
Right.
Right. Yeah.
Right.
Yeah.
Why?
Why?
In different tiers of
Why is
medications.
it-
I mean, I'm on
Yeah.
a tier 4 medication for ADHD, and it's so much more expensive than some of the others, but it's more effective for me. And some of the others, I mean, I've tried several of the available options, and it's the only one that gives me the benefits that I need without making me feel uncomfortable.
Yeah.
So,
All right, another show.
Another show. we could do a show on the pharmacy industry. I think we could do another show on. We haven't even
let's
talked.
start planning that.
Yeah, other types of insurance. I mean, you're talking car,
Home.
life. Oh, my life insurance. I mean, some of that's kind of a joke.
You're leaving my area of expertise here.
We're gonna have, we could do multiple shows. My thinking when I think about insurance. Oh, by the way, Benjamin Franklin started the first insurance company in the country. It was home insurance in Philadelphia, Benjamin Franklin. But when I think of insurance, I think of a community thing.
Right.
I don't think of for profit. It just doesn't click in my mind.
Something where everyone pays in.
Right.
And the benefits are.
A community type thing, concept that, hey, it's like, hey, if something bad happens, we got your back, neighbor. That kind of concept. And how it's developed into this big, complex, money-making thing. And not everybody's making money. I was kind of surprised that there's a lot of hospitals that are actually struggling and not making a
rural
profit.
hospitals especially.
Yeah.
And, our partners at Benson and at Northern Cochise and at Copper Queen, their margins are not huge.
And yet the cost is so high, but
Right.
they're, so there's some disconnect.
We need each other. We need
Yeah.
our partner at Canyon Vista, which is a for-profit hospital, but also has that same mandate to, if someone presents in their emergency room, they need to stabilize them. That is a requirement. They can't refuse to see them.
And so something's got to be done. Something's got to be done to change it. And at least we've learned here in Cochise County, there's a place you can go for help.
Chiricahua Community Health
Yeah.
Centers, and we really want to emphasize this point. There has been a lot of talk about changes in Medicaid, the Affordable Care Act, Marketplace, etc. We are going to be here, full stop. Our clinics will remain open, and we are going to find a way to navigate and make sure that no one's turned away.
And Tara, your mother can help.
She can.
She can.
So,
I call her all the time. She's not local, though.
oh, she's not local.
No.
Okay, unfortunate. Okay, we'll have to. Yeah. I thought she
can't
was.
bring her on.
Yeah.
Sadly.
Yeah.
So yeah, if you're in one of these categories, one of these unlucky people, not like me, who's getting everything covered, but you're in one of the other categories, struggling, you need health care, you don't think you can afford it, there is a place to go.
Right.
And
And
right
again,
here.
we take everybody. More than a quarter of our patients are commercially insured. You receive the highest quality care of any private practice. It is on par. So the quality measures, they're on our website, cchci.org. You'll see across the bottom all of the quality recognition badges that we've been awarded.
And maybe the next generation, you guys will get a little smarter than us and decide to fix this whole system nationwide and come up with something that makes
Tara,
sense.
I want to just speak for a moment about Common Ground, the name of this
Yes,
show.
yeah.
And that common ground when it comes to health insurance. Health insurance is preventative care. It helps everyone. And that kind of common ground, if we were able to come to that, to say, you know, at a population health level, that those who are insured provide less risk to you and your family than someone who's uninsured. Isn't that the kind of common ground place that we can start?
Yeah.
Right.
We'd love to.
Taking care of each other is important.
Yeah,
Yep.
It's about community.
yeah.
And that's what our show's about.
Exactly.
What's best for everybody?
Right.
That's what
Right.
you and
What works for the vast majority of us.
and what can we agree on? And if
Right.
if you don't agree with us, send us a message and let
Please
us
do.
know why. Let us know why. And if you want to be a guest on Common Ground,
We'd love to have you.
yeah, even if it's a topic we haven't thought of before, let us know. Again, we'd like to focus on big issues, but concentrate right here in
Right in
Cochise
Cochise
County.
Yeah.
What do we have? You know, what's working, what's not working, and thank you so much.
Yes,
Sure.
Dennis,
I
thank you
learned
for
a
joining
lot.
us today.
No, it was my pleasure, and I'll come back anytime.
I'm feeling better about my retirement already.
Hey,
I'm like,
I want you to.
A little more secure.
We
Yeah,
have
yeah.
6,200 square miles, right? Cochise County. We're larger than Rhode Island and Connecticut put together. We're larger than 80 countries the UN recognizes.
Wow.
Wow.
We are in the Republic of Cochise County. The
Wow.
Rock, we call it. The Rock.
Okay. No, thank you so much. I'm gonna
Thank you.
for being here.
Dennis,
Really
always a
great.
pleasure.
No, really great. Thank you.
So-
Very inspiring.
We're gonna have to wrap it up. This is the end of the first show of Common Ground on Cool FM 104.1. And look forward, we're gonna have a show once every month. It'll
Yes.
always be on the first Sunday of the month at 8 a.m. on Cool FM 104.1 radio. And then later that evening, it will be on Cool FM Facebook and YouTube. Will be the video portion or take of this show. So look for us every month. We're going to have a hot topic for you. I guarantee you. What's our limit on topics, Tara?
I don't know that we really have any limit
No.
on topics. I mean, I think that that's one of the things that we agreed on was that we were willing to talk about just about anything as long as we can find common ground and bring it all local.
There you go.
And I would encourage you, if you believe that Health for All is something that you can support, if it's common ground for you, cchci.org, hit that donate button and make it happen for your neighbors.
There you go. All right. We're going
Thanks.
to tune out. Thank you.